Bank holiday Mondays are usually quieter for hospitals, but even today, ambulances were queuing to discharge patients. The pressures on the NHS are unrelenting, and now the Royal College of Emergency Medicine has warned there is worse to come.
The day after bank holidays historically are always very, very tough. Not enough people have been discharged from the hospitals over the weekend, and we've had an extra day of people not being discharged, so the hospitals will be full. This means that the emergency department get full. Our GPs will find people who've got problems that need emergency care and will send them up. So we get this perfect storm.
And the college claimed that the urgent and emergency care crisis was now responsible for hundreds of excess deaths every week.
Through the last year, there's been excess mortality. So this is the number of excess deaths compared to an average. And that's been running somewhere between about 800 to nearly 1,500 patients extra per week. Now, I think problems related to urgent and emergency care are contributing somewhere between a quarter to a third of these problems. 500 deaths a week is not coping.
NHS England cast doubt on the figures and warned there may be many reasons for higher mortality levels than normal. Nevertheless, they acknowledged the NHS was under significant pressure. Over the new year, more than a dozen hospitals and ambulance trusts declared critical incidents. Staff have taken to social media to describe the scenes in their hospitals. This blog from one senior emergency medicine doctor shared thousands of times.
Last night, 60% of the patients in ED had been there for more than 12 hours, some for more than 40. Many I saw the night before still in the same place when I came on. 87-year-olds coming in after falls, sitting on chairs for 18 hours. Other elderly patients lying in their own urine for hours because there's no staff or even room to change them into something dry. People lying on the floor because there's no chairs left. Trolleys parked literally wherever we can put them.
There has been no word from the Health Secretary, although a statement from the Department of Health said, "We recognise the pressures the NHS is facing following the impact of the pandemic and are working tirelessly to ensure people get the care they need." Flu and COVID are compounding the problems, along with delayed discharges, patients well enough to leave but with nowhere safe to go. And this month we'll see more strikes by nurses and paramedics, with no sign of the government opening negotiations.